okay? But otherwise, you're welcome to leave your camera on. And as far as your microphone, we would like everyone to keep their microphone off until we get to the question and answer period, which will be in about 30 minutes or so. And then if you have any questions, like as we're speaking, if you can just put it in the chat. Is there any questions?
Oh, good.
All right, so we're going to go ahead and get started. And I'm going to start with introductions. And I'm Ellen Snelling, so I'm the chair of the Hillsborough County Anti-Drug Alliance. And I've been a volunteer for about 20 years. The reason I got into this field is because I have a daughter who's in recovery. And I'm going to introduce Cindy Grant. She is the director of the Anti-Drug Alliance. Hey,
hi, everybody. Welcome to our second vaping prevention education and chat. So glad you could all come. And we'll turn it right over and get started.
Okay. Well, sorry about my dog. My son will keep him quiet. So we're going to, like I said, just put your microphones on mute for now. And we're going to encourage questions and answers, like I said, after we have our speakers. And our very first speaker will be Dr. Marilyn Bui, who's with Moffitt Cancer Center. And she's a senior member, Departments of Anatomic Pathology and Sarcoma, scientific director of Analytic Microscopy Core. And also she's with the Morsani College of Medicine at the University of South Florida. And I met Dr. Bui on a Twitter chat with a group of pathologists. And you know, I'm not a pathologist, but I thought it was really interesting. It was on vape lung injury. And at the very end, we kind of got together, and Dr. Bui reached out to me and wanted to see how we could get the information from the doctors to the youth. And take it away, Dr. Bui.
Thank you. So now I'm going to share my screen. So let's do share screen. So I'm going to talk about, so share. Can you see my screen? So I'm going to talk about what is pathology. Pathology is a subspecialty of medicine. Pathologists are a group of medical doctors. We're specialized in diagnosis. For example, now it's COVID-19. So there's this laboratory test to diagnose COVID-19. Where does it go? Goes to pathology laboratory. Pathologists will sign off the report. So for women, breast cancer, cervical cancer screening, who make the diagnosis? Pathologists do, right? So that's what we do in a nutshell. So now let me show you a very, we need to continue to share screen. So this is my shared screen. So I want to show you a video clip. Okay, so it's from here. So let's go over here. Let's go to College of American Pathologists. That is the association that we all a member of. So this shows what
Dr. Bui, we can't see your screen right now.
Oh, you cannot? Okay, over here. Okay, all right, now you can see.
Mm-hmm.
So this is what we see for pathologists. All right. So the connection sometimes is good, sometimes it's not quite good. So let's see. Oh, well. So for time's sake, so we're not going to wait for YouTube to get it clicked in. So last time I showed a little video showing what pathologists do. And now I'm going to stop sharing. So now you can see my office. Basically, if you come to the office and then your doctor did a biopsy of you, then we're going to make your tissue into those glass slides. And then we put it under microscope. So then we can examine the cells or tissue under the microscope and generate diagnosis. So the information provided by the pathologist will show the clinicians how to treat the patients. So that's what we basically do. The reason we get into vaping prevention because lung pathologists are the group of pathologists examine the tissues to make diagnosis of vaping damage and all those damages. And Dr. Yasmin is one of those doctors who is going to show us her expertise. So for me, I'm a practicing pathologist at Moffitt Cancer Center. So how many people know what Moffitt Cancer Center is? Yeah, so everybody does. That's one of the big things in Tampa. We are one of the NIH/NCI designated cancer center. I have been here for 15 years. And then in addition to take care of the patients one at a time, it is also my passion to volunteer my time in community outreach and in volunteering in professional societies. So be able to interact with you guys and to share knowledge is really enjoyable. So now I'm going to turn over the mic to other people and learning from everyone from this group. Thank you.
Right, thanks, Dr. Bui. And I really want to make it clear how much Dr. Bui is the person who got this all going. And she, like I said, we met on Twitter, and it was like between 9 and 10 at night, which shows you how dedicated she is. And just towards the end, they were talking about all these pretty horrible things that happen to young people's lungs from vaping. And they said, we really got to get the message across to young people because they don't know, they're young, they don't really realize there's risk to this. How can we reach out? And I said, oh, hey, I'm from Tampa and we're working on a project where we're trying to reach out to young people and educate them. And she goes, oh my gosh, I'm from Tampa, at Moffitt. And I'm thinking, it's just so funny, it's a small world, But she she got right back with me and then started, she has the calls and the Zoom meetings and she keeps us on task. So Dr. Bui is very good at that. So thank you very much, Dr. Bui.
Thank you.
Okay, I'm gonna do a very quick video about some things, just an introduction to vaping, which I know a lot of the youth and a lot of the advisors know quite a bit about it, but there may be something you don't know. So, and I have some really up-to-date information too. So I'm gonna share my screen. Let's see, where is it? Here we go. And slideshow. All right, here we go. So first of all, I'm with the Hillsborough County Anti-Drug Alliance. I joined in around year 2000. It's been around since 1989. And our mission is to promote healthy communities in Hillsborough County free of substance abuse and addiction through education, collaboration, and advocacy. And our vision is a community where youth and families are safe, healthy, and free of substance abuse and addiction. And I think we would all be on the same page with this. And if you want to learn more about us, you go to HCADA.com and you find out a lot of information. You can get in touch with us and also find out about all our different task force if you want to get involved and be a volunteer. So why are we so interested in vaping? The reason is because it is one of the drugs of choice of our young people. And in the last 5 years, it has taken off like fire. So in 2019, this is a Florida Youth Tobacco Survey, which you can get online. High school students, more than 1 in 4 are vaping in the last 30 days. That's considered recent use. So 1 out of 4 is vaping. That's huge. So it's catching up to alcohol, which is the #1 drug of youth. Ever tried vaping? Almost 40%. That's getting close to 50%. So you can see how big of a problem this is. Exposed to secondhand vapor smoke, over 50% have been exposed to the smoke. And you know, some young people, they think it's cool and they're blowing, you know, vapor rings and that type of thing. So even if you're not doing it yourself, you are more than likely going to be exposed. And then finally, almost 10% are using on the school campus. So you can see that why we're wanting to address this and try to prevent it. So what is an e-cigarette? You got your battery, got your atomizer, absorbent material, and there you go, there's your vapor coming out. The main type that is used by our youth is not the old tanks of yesteryear, where we used to see people with this large device and you see this huge billow of, you know, smoke or cloud coming out, or you see somebody roll down their car window and then it looks like the car's on fire. So that isn't so much. They're finding more and more discreet ways for youth to use. So this is basically a Joule type unit. So it has its rechargeable battery, it's got a cover and a pod. And as much as young people may want to convince their parents or their teachers or, you know, any responsible adults that they're just flavor or they're just vapor, well, they're not. They contain nicotine, and not only nicotine, you can also get it with marijuana. So it's really a drug device. Now you may have heard this little myth that it's just vapor. You know, it's just a little cloud of vapor. Nope. So cigarettes, we already know, you know, everyone's aware of how many terrible chemicals are in there and how bad they are for their lungs. This is just some of the chemicals. There's many, there's probably 400. But what about e-cigarettes? Isn't it just water vapor? So these are showing you a lot of the different chemicals that are found in this aerosol. So it's not a vapor, it's really an aerosol. That's the way to think of it. It's a chemical soup. And it looks so fun and pleasant, and there's fruit flavors. This is a local store here in New Tampa area. And when you walk in, a lot of people would say, wow, this looks like candy, right? And they have flavors of candy. Who do you think this is aimed at? I don't think it's aimed at adults. It's very much aimed at our young people. You know, originally these e-cigarettes were made to try to help smokers, adult smokers, stop smoking, because we all know how bad smoking is and we know it causes cancer. So it was an alternative. But unfortunately, the FDA did not regulate them the way they should because they wanted people to stop smoking. It got out of control, and what happened is Juul and some others really took advantage in their marketing to children. So how much nicotine are in these devices? A pack of cigarettes is about 20 milligrams of nicotine, so that's about 1 milligram per cigarette. So there you go. It looks stinky when it's like that. Now a Juul pod, you think it might be a pack of cigarettes? No, actually it's the same as 2 packs of cigarettes. So it's loaded with nicotine. And just think about how discreet this is. Instead of a pack with 20 cigarettes, you have 1 Juul, and you put the pod on it, and there you go. You got 2 packs of cigarettes already. So that's what that looks like. Now, the latest thing is called a puff bar. So Juuls are kind of going out of vogue, believe it or not. You know, we finally figured out what a Juul is. I went and bought one at a racetrack because I wanted to show, you know, parents what it looked like. And apparently that's getting more outdated as far as young people. So the puff bar is the thing. 50 milligrams of nicotine, and that's compared to 20 milligrams in a pack of cigarettes. That's a lot of nicotine. And these are disposable. And then a Surin pod, this is not something, I asked my daughter, she has vaped, and she said she's never heard of this, but I just thought I'd throw it in there because it's 90 cigarettes, it's just ridiculous. So all pods contain high levels of nicotine, and unfortunately, it is not regulated by the FDA. They're still working on it. I don't know how long it's going to take them, but believe it or not, it's not regulated by the FDA. So the body on nicotine. Nicotine affects the brain, and the young brain is developing until about age 25. So any drug that a young person uses, whether it's alcohol, nicotine, or marijuana, is going to affect the developing brain. Nicotine causes the heart to beat faster, and it causes an increase in what's called the fight or flight response. So it's going to put extra work on the heart. It also causes trouble breathing. So you're not breathing in fresh air at all. You're breathing in chemicals. And then finally, it can cause problems with your stomach. So you can see vaping affects a lot of different organs in the body. It's just not healthy. There's no fun in the lungs with vaping. Inflammation of the airways, destruction of air sacs, and then a weaker immune response. And then this is very, very important right now, because what do we have out here in our world right now? What's huge is the pandemic, COVID-19. That's an infection. It's a virus. We do not want any of our young people to have a weaker immune system. Now, I'm just going to get into a couple more things, and I told you about puff bars. Well, finally, the FDA is catching up with puff bars. They found what happened is earlier this year, the FDA cracked down on Juul and said you cannot no longer do flavors. So the only two flavors for Juul are menthol and tobacco, but all the fruit flavors, peach, strawberry, raspberry, all those are no longer being used. So Puff Bar filled in the space. They somehow got around it, and they're having tons of different flavors. You can see some of them right here. So the FDA just on Monday, that's why I said this is hot news. They sent a letter to the company of Puff Bar, and they are to remove all Puff Bar e-cigarettes from the market within 15 days. Now, I'm hoping they mean business, and they're really going to go in there and send their agents in and confiscate them if they're not taken out, or give them huge fines. But this is really big news. So flavors like mango, pink lemonade, strawberry. They also sent warning letters to other companies that are selling a similar product. And some of them have packaging is similar to Twinkies and Cinnamon Toast Crunch. So again, the marketing directly towards children. And like I said, Juul's already banned from selling flavors, and that's where this Puff Bars filled in the space that was open with them getting out on the market. And then finally, we have the age 21 tobacco law. So now in the United States, in every state, you have to be 21 to purchase any type of tobacco product, including vape. So for resources, we have tobaccofreeflorida.com, the Truth Initiative, and the Anti-Drug Alliance. So anyone who's interested in prevention information or how to get help if they're already using. And that is my presentation. And we now will go over to Dr. Yasmin Butt. Thank you.
Hi, that was a great presentation. So let me share my screen. And let's see. So I apologize, I'll be looking sideways because I have two screens and my PowerPoint's going to show up on my other screen. All right, so here's mine. Okay. So can you guys see my screen?
Yes.
All right, excellent. So I'm going to talk to you today about EVALI, which is basically the CDC's long-term they came up with for vaping-associated lung injury. So who am I? So my name is Dr. Yasmin Butt. I work at Mayo Clinic in Scottsdale, Arizona. So hopefully most of you guys have heard of Mayo Clinic. I'm a pulmonary pathologist. So like Dr. Bui mentioned, pathologists are sort of the doctors behind the doctors. Anytime you have a diagnosis of any type of cancer, that comes from a pathologist. It's usually given to you by your oncologist, your radiologist, your internal medicine doctor, but if you look at the bottom of that report, we're the ones that came up with it. So we're a little bit hidden in medicine, but I think we have really cool jobs. We get to see a lot of neat things, and like Dr. Bui said, anything that comes out of the body. So whether you get a mole taken off or whether you have a piece of a horrible tumor taken out to try to learn out what kind of tumor it is, it all comes to us. And so we take that tissue and we take really, really, really tiny pieces of it. So this is a glass slide, just like Dr. Bui showed you. And what we do is after we do special processing on the tissue, we take a very thin section, usually 4 microns. So that's like thinner than a piece of paper. It's thinner than 1 cell. So we're basically cutting through cells. And we take that tissue and we press it onto a glass slide, heat it, and then stain it. And then we could use our microscopes to actually look at it. So we're obviously looking at things quite magnified. We look at individual cells. So that's how we come up with our diagnoses. So how did I get into vaping-associated lung injury? Doesn't seem like something you would think a pathologist would be associated with. Well, like I said, I'm a pulmonary pathologist, so I am interested in all kinds of diseases that affect the lungs. And here in Arizona, we have a really busy consultation service for pulmonary pathology. So basically our group gets cases from all over the country, and we would get cases from around the world that are difficult lung cases, essentially, that other people are having difficulty figuring out what they are. And so we were in an ideal situation to sort of be at the forefront of what findings were actually seen in these patients' lungs, because people were getting young patients coming in, they didn't have any infection, they didn't have anything wrong with them. And so the final thing that anyone does when they can't figure out what they have otherwise is take a biopsy. So they were taking pieces of people's lungs, sending them to their local pathologist and saying, hey, what's going on? And they didn't know. So last year, late in 2019, we started seeing all these cases of vaping associated lung injury. And no one had described them before, obviously something new. And we were able to put together a paper in the New England Journal that talked about the different findings that we see. So that's how I sort of fell into vaping, is I'm part of the service and we start seeing all these cases. So to talk to you about vaping associated lung injury, what does it actually look at? First, I want to show you guys what actual lung looks like under the microscope. So this is actually what we look at under the microscope. So can you guys see my mouse? Hopefully. Okay. So all of the white spaces, the empty spaces, that's where air would be. So this is a piece of normal lung. So that's where air would be, is all these white empty spaces. Okay. So if you think about it, you breathe in through your trachea, your windpipe, and then that splits and goes into your lungs on either side of your chest. So it's the easiest way to think about the lungs is those pipes that carry air split into smaller and smaller and smaller and smaller pieces, kind of like the tree branches, essentially. And at the very end of those pieces, you have little sacs called alveolar sacs. And these lines that you're seeing in this picture are the outside linings of those sacs. So pathology is a lot of 3 dimensions into 2 dimensions. So it's a 3-dimensional structure, but we're taking a slice of it to look at 2 dimensions. And so at these sacs that are extremely tiny at the very end of this sort of tree branching of all these alveolar spaces at the end is where air exchange takes place. Now I'm sure everyone knows or has heard of this, that you breathe to get oxygen into your blood. And so you have lots of tiny little blood vessels that run alongside all of those air spaces. And then the air that you breathe in, you get the blood come next to it. It's actually individual red blood cells and very, very tiny blood vessels called capillaries run next to those air spaces, and that's where oxygen exchange takes place. So I'm showing you this just to give you an idea of what normal lungs should look like and what normally happens in your lungs. So the whole point is to get oxygen into your bloodstream. You don't want to get anything else into your bloodstream. All right, so this is an example, and this is just a higher power image showing you this delicate system. So this is an alveolar sac, and you can see there's basically this red here. This is a red blood cell. It's a single red blood cell. So the place where air exchange takes place is only a couple of cells thick. So it's a very delicate system. Certainly not something you want to damage. So now this is what a section of a lung of a patient that had been vaping. And just for comparison, again, on the bottom, you see all these white spaces. This is what it should look like. And if you look at the top, all of a sudden, all those white spaces are gone. So what's happening here is you're getting all of this injury in the lung, and you're getting those spaces filled up with compensatory changes from your lung due to the damage that it received from the vaping. And so as you can imagine, it's quite difficult to breathe through all of this material. And here's another picture. So this is a slightly larger airway. On the bottom is what it should look like. So their blood vessel is on the right. So like I said, the blood vessel and the airways go together in the lung. So your blood vessel's on the right, and then this is an airway on the left. So this is one of the larger tubes before it goes down into the very tiny sacs. And then you see this pink and purple stuff on the outside. That's the lining. That's what it should normally look like. So what we were seeing in a lot of the people that were vaping is all that lining, those lining cells were dying. And they were sloughing off, they're falling off and filling that airspace. So as you can imagine, again, difficult to breathe when your airspace is full of your own dead cells. So this is your damaged airway. And so that's when we realized that the damage we were seeing in his lungs was kind of akin to a chemical injury, like people in World War II breathing in mustard gas or something like that. You were getting this like damage, chemical damage in your lungs from the vaping. So pretty severe injuries. So then the question is, what caused this? So what the CDC and a whole bunch of other groups eventually came to the conclusion is it was cutting agents. Cutting agents is what caused this particular surge in vaping-associated lung injury. So what is a cutting agent? So cutting agents is something that sellers use in order to artificially increase the volume of their product. So if you're thinking about nicotine versus marijuana, obviously these chemicals are expensive. And so if you cut them, you are able to increase the volume of your product and sell it, basically make more money to sell less actual expensive product. And what people were using is vitamin E acetate, which is, it's a vitamin and it's an oil soluble vitamin, and they were using it to cut their product. And so then what was happening is the vitamin E acetate was breaking down due to the heating element in the vaping pens and all the various vaping devices. We were getting basic toxic byproducts from the vitamin E acetate. And that was what was causing those essentially chemical burns and all that damage in the lungs. So that's what caused this, almost all of these current cases of vaping associated lung injury. So, you might ask yourself, so what are the consequences of vaping? Because, all right, so as I'm going to vape, I knew lots of people that vape. What are the consequences? The truth is, for the majority of people, the consequences are nothing. Most people vape. Most of the people that vape aren't going to have any problems. Some people have mild respiratory distress, trouble breathing. Maybe they think they have a cold. They don't even realize that there's something going on, and up to and including death. Some people have died from vaping. And I just wanted to talk a little bit about some of the medical devices and treatments that you've probably heard about in the news. Now, often these are talked about in regards to COVID, since COVID is also a respiratory illness, but we have the same toolkit when we're treating people with vaping-associated lung injury, ventilators. So someone might say, well, if something bad happens to me, I'll get on a ventilator, and then I'll get off the ventilator and I'll be fine. And the truth is that a lot of people that get on ventilators don't ever come off them. You can pass away. The ventilator itself causes damage to your lungs. If you remember that picture I showed you earlier, if you go back, now if you think about those delicate alveolar sacs where the airspace exchange happens, and then you have all this damaged tissue and dead cells on top of it, it's a little bit like trying to breathe with a wet rag thrown over your face. It's extremely difficult. So even if you put someone on a ventilator, which is essentially a device that forces air into your lungs, you're still not necessarily going to be able to make that person breathe normally. And so the ventilator itself does damage. It oftentimes is not able to overcome the damage that's already there. So it's not a cure-all, so to speak. Apologies. So the other thing that probably shows up in popular literature as well is lung transplants. And it's something that I think in movies and in articles, you think of, okay, the most worst thing has happened, your lungs are completely destroyed and you have to have a lung transplant. The truth about lung transplants is it is not a magical fix. You don't get your organs and then waltz off into the sunset and you're great. You're like, oh yeah, I have somebody else's lungs. One, it's difficult to get lungs. People are on waiting lists for long periods of time. When you do get the lung, there are so many complications associated with lung transplants. Many people don't wake up from the procedure. It's a very significant surgery to have a lung transplant. You're immunosuppressed, meaning in order for you not to reject your lungs, you have to suppress your own immune system. So people that have transplants are very likely to get horrible infections. And then you also can reject your lungs. And the truth is that over half the people that get lung transplants have died within 5 years. And so I just throw that out there, not that, the majority of people that vape get lung transplants, but if you're thinking in your head, well, worst case, I would have to get a lung transplant. I feel like these transplants are oftentimes the beginning of the end. It's not as if you're going to live a full life if you have a lung transplant. So long-term consequences, this is something that we get asked a lot is, what happens to these people that recover? Because most of the people did eventually recover. Then the truth is we don't know all of the long-term consequences. I think there will be a percentage of people that end up with scarring in their lung tissue. So just like anything, if you cut your skin, you get a scar. If you damage your lungs, you can get scars. And scars in your lung, obviously you can't breathe through scar tissue. And so you could potentially have long-term respiratory complications. And also I think we are very concerned about outbreaks continuing in the future. Right now, we have actually seen anecdotally in our service here at Mayo Clinic an uptick in cases of vaping associated lung injury. They dropped off to almost nothing after late last year, and now they're coming back again. And we don't know exactly why. My guess would be because of COVID, people are quarantined, they're bored. Perhaps people on the gray and black market who are selling these devices are, pulling their devices that they've taken off or using vitamin E acetate again because they're desperate to make money. This is a supposition on my part. I don't know why the cases are going back up again, but it hasn't gone away. And I think that it's very possible that there will be other chemicals, other cutting agents, other things in the future that will prove to cause vaping associated lung injury again. I think as long as people are vaping, that there's a chance that something bad could happen to you. And I want to touch a little bit on something that Ellen had mentioned. Who should be vaping exactly? Is this something we should be banning? Is what should we do with this? And I think vaping is something that should be done by people who are addicted to nicotine because they smoke cigarettes and they've tried other devices, patches and things like that, and they can't quit smoking. And so vaping, I think, can be very useful in that particular subset of people who need a segue into not using nicotine in any way. And I think it can be quite valuable for those people. Cigarette smoking kills a huge number of people every year. As a pulmonary pathologist, I diagnose lung cancer every single day. And the survival rates for lung cancer are not great. So of course, we do not advocate people to smoke cigarettes either. And to me, there is no reason to vape outside of this context. It should not be recreational. I don't see any value in it. And obviously anything that has nicotine in it, it's an addictive substance. So all you're doing is serving to addict yourself to nicotine. And it greatly increases your chances of smoking cigarettes down the road, which will increase your risk of lung cancer and a host of other things. And of course, like we're talking about, there's always that chance that you could end up with one of these vaping associated lung injuries and end up in the hospital. So the truth of the matter is that most people who vape will have no immediate consequences. But there's a small percentage who will suffer consequences, some very severe, and some might even die. And so you have to ask yourself, is it worth the risk? And to me, nothing is worth the risk of my life. And I would hope that you feel the same way. So I'll end with a message of please just breathe air. There really isn't any device, anything that you could smoke or breathe that's going to be safe. It's not a thing. I see so much on this service looking at people's lungs day in and day out, and the things that people breathe never ceases to amaze me, and it does cause problems and it does affect your lungs. And even if you're not ending up in the hospital, I think there's probably a huge number of people out there that actually do have subclinical findings in their lungs. So basically it's not causing a symptom yet, but maybe it will 20 years from now. One of my fears is that 20, 30 years from now, we're going to see this huge influx of people who vaped and didn't have any consequences in the beginning, but it caused small chronic damage over time. And we don't know, but I have that suspicion. So don't let your lungs end up on a slide on my desk. So please don't vape. And this particular slide is lung tissue from someone who vaped.
Oh, wow.
So it's not a prop, it's real. So that's my presentation, and I'm happy to take any questions. Take my sharing off.
All right, well, thank you so much. That was really interesting. I love seeing those slides and just the visual of the lung tissue in the alveolar sacs, and then to be filled up. I mean, there's no way to breathe through that. That's just amazing. And I think to your point, it's important to say that for people under age 21, and specifically, their lungs are actually, not only is their brain developing, their lungs are developing. So any type of a drug that you take is going to affect your whole body, but vaping in particular is going to affect your lung, even in the growth of your lungs. And as you also mentioned, Dr. Butt, that it can lead to other drugs such as smoking. It's just so crazy when you think about young people using this device. It's supposed to help people stop smoking, but the research is showing that it actually can lead eventually to cigarette smoking. So it's a huge ploy by big tobacco, to be honest, because if you see who owns these companies, the vape companies, it's the tobacco companies. And why would they do this? Because they know nicotine's addictive. They know young people can become addicted. That's why they made the products designed towards young people.
Right.
And they need replacement for the cigarette smokers who are dying. I mean, that's just how I look at it. But I'd like to open up for discussion. And if we have any of our students have a question.
I'll say too, it's the same story again. When cigarettes first came out, you know, back in the early 1900s, doctors were prescribing them to people to calm down, and there was no definitive proof that they caused cancer or caused problems. And it took decades. It took decades to get it into the social consciousness that cigarettes are in fact bad for you. And it just feels like the same story again with vaping. I just don't see any reason to addict yourself to a chemical. It serves no purpose. And the younger you get addicted, the longer you can be addicted and the longer you can buy these products. And it's horrible, just from my perspective. I can't imagine hurting people for the pursuit of profit, but that's where we are right now.
I have a question for you, Yasmin.
Absolutely.
So you were saying that you suggest that they vape if they're trying to stop smoking, but the insert for, not the jewel, but the other one, the pod, was like 90 cigarettes in one. That's even worse though, right?
So I think, yeah, I agree. 90 cigarettes in one is much worse. So this is the problem, because when vaping first was created, I think it was created as a medical tool, just like nicotine patches and things like that. And so the idea is to use it as a segue, because since the argument was that, well, vaping has less chemicals in it compared to a traditional cigarette. So the idea is to use it as a segue. Now, would I recommend vaping something that has higher nicotine content than what you're already smoking to get off of cigarettes? Absolutely not. I would not. I think rather than use the term recommendation, I would say more that I don't know. I won't pretend to understand what people go through when they're trying to quit cigarettes. I can't imagine how horrible it is to be addicted to a chemical, and it's hard to stop. It's something that's easy not to start, but once you do start, it's very hard to stop. And so I wouldn't want to remove something from the market that could potentially help those people eventually stop using nicotine. But certainly that's something that you should consult with your own physician about, and look at the nicotine concentrations and decide if that would be a good thing for you.
I don't smoke, so it wasn't.
Great question. That's a great question. I appreciate that.
Well, one thing I wanted to mention is that in Europe, they are regulated. That's why sometimes you don't hear as many problems with vaping in Europe, because there's actually regulation where they say how much nicotine can be in it. They can't have products like we have here. They can't sell it. So it's just one of those out of control industries that we've allowed in this country. And we're just waiting for the FDA to step in, because at least with tobacco and cigarettes, I think they've done a pretty good job of regulating a terrible product. It's expensive. It's not as easy to get. We've done a great job bringing down tobacco and cigarette numbers. Our youth are only, like I said, there's 26% that have vaped in the last month. Only 2% smoked a cigarette, which is great. Although, now we're finding out that vaping can lead to, when they're maybe college age, to smoking. But we really need the regulation of these products. It's all about profit and nothing about health.
I feel like this should be a medical device, not something that's just sold everywhere in stores with melon or whatever.
And also, we really applaud to people like Alan, Cindy, and all the advisors in this group dedicated your whole life trying to help young people to prevent all this, because for young people, they all have this impressionable mind. They need the message coming from all ends, their parents, their siblings, their relatives, their friends, their teacher, their counselors, and their medical doctor all tell them to no to vaping, no to cigarette, no to alcohol, because all those chemicals are designed for you to be addicted. As Dr. Butt said, it's easier to say no, don't get hooked on, then you get hooked on and try to get off, because that's much harder journey, and many of us are not that strong. So how do we create that network to to help young people, that's a real thing, because we would rather them not to get into than they get into, we help them to get off. So is there anything that we can do from school, from community?
If that was an open question in the forum, I think educating everybody. I think that's a big thing, because a lot of people wouldn't know about this.
Right.
And certain common, because everything is so new.
Mm-hmm.
And everybody knows at this point cigarettes are bad, and tobacco in its pure form is very harmful. But with, you know, e-cigarettes, it's all very new, and not everybody knows the repercussions that everything will eventually lead to. So I think the first step is for schools to educate a bit more, not necessarily with just the students, but with faculty and parents as well.
Right. So then,
educating our young people, and you all can give like messages from peer to peer, I think is great too. That's one reason we wanted all the young people on this particular Zoom chat, so that you all can be educated and then spread the word.
For example, if your school has science projects or things like that, and then you could choose this as one of the topics to share your knowledge with the others. And also for parents-teacher conferences, maybe they can carve out 15 minutes or so just to address this issue, right? And also, and for example, in the last meeting, there's one person said the weak link is that when you take the school bus from your home to school, because when you're waiting for the bus, there will be some parents around, so you are being supervised. When you get to school, there are teachers and advisors. But when you're on the bus driver is adult, but he or she is busy driving. So the kids will be interacting, and somebody may offer vaping. And then some people may just be curious and give it a try, and then liked it, and then eventually get addicted. And then eventually that's not enough, and then move up to heavier chemicals to be abused and then addicted to. So there are a lot of things that I think as a group, as a social network, that we can do. So for example, you all have this buddy system to encourage each other not to vape, constantly remind each other, or things like that. So education is number one, but what's the plan in addition to Zoom meetings, spread words? But for the people attending the meeting, is there any actions that, how do you plan to take this information back to where you're at and share the knowledge? I'd like to hear some of these conversations.
If I can just say one thing, I find the way it's delivered is very effective. As far as if you're going to just spit facts to kids, they don't want to hear it. Like if you just deliver, you know, this is all very informative right now, but we have to be creative how we deliver these messages to kids. You know, this is the way we can deliver it to the parents so that they're educated. But with the kids that are in school, you know, middle and high school kids, it has to be a fun way, and you must include them. So if we involve them like we are, and then make creative approaches to educate them, such as any type of, a lot of the kids like the arts, like the music, and if we get these creative ways flowing, a lot of them tend to turn their focus and then become less likely to do this stuff, in my experience. So I'm just speaking from the way the delivery has been on my end, that the kids kind of lose interest. They really do. I do agree with using vape to quit smoking, as it did help me. I was a smoker and I did vape, and it did eventually just stop. but for the kids, you're right, and the market is making it so so fun and colorful for these kids to try. So we have to definitely use a creative approach to turn the direction, I feel.
So that means we need speak person from the kids so they can talk among
Right.
peers. And also we need people who they really look up to, some celebrities and all that, to make not vaping, resist to vaping something cool and something rewarding to do. So if somebody can speak on their behalf, and then that will, because as you said, this is all good. Parents need this information and to know that they are going to help the kids to do, but the kids don't really care about most of the
Right.
kids, right?
Right.
Yeah,
Right.
this is too dry to them.
Right.
Yeah.
But I would love to see some of you on this meeting right now, if you want to come up with a PSA, a song, you know, something creative like we were just talking about. Maybe we can feature you on our next Vape Zoom call. And we can have a little short PSA that you think might reach out to the young people that we're trying to reach out to. And I would love to have a celebrity spokesperson, if anyone knows anyone, you know, that would be great. There's a lot of really good ideas, but yeah, just getting education. I think we all know that have been doing this for a long time. Educating is great. You need the information, but that doesn't change behavior. So you have to take more steps. And like you said, it has to be an environmental approach, which is the whole community has to be involved. We all need to be on the same page, but youth need to hear from other youth. I think that really helps. We need to get the norm of being, it's not cool to vape, but it's like cigarettes. And I think the big vape, as a, you know, big tobacco, big vape, I think we really need to work on that angle, because it is 100% true. They're just trying to make money off of young people to addict them to make money. And if we can get that point across and have young people look into advertisements and show how they think, just like we did with tobacco, I think something like that might help.
Right. So if there is a competition for the youth to submit artwork, songs, or anything that they can come up with,
Yeah, let's have a competition.
Right? To make, and then with a little prize,
Yes.
with little prize money or scholarship or something, right?
I think we have a good idea here. Are there any other young people that want to give us some comments or have a question?
A young person, I have a question from.
So I have one youngest with a little bow on her head.
She's probably too young to have a comment. Who? I heard someone trying to make a comment. Can you say your name?
This is Denise. I was just giving a question from the chat room.
Huh?
I was asking that are the consequences of vaping or smoking marijuana the same? The doctors?
Can somebody rephrase that question? There's a lot of
in the chat box.
I think she was saying they want to know the vaping of like nicotine versus vaping marijuana, if it has the same consequences or they both have consequences. That was the question, comparing those two, because we find in our tobacco classes we're teaching young people that it's very common that they do both. It's not just nicotine. A lot of times they go from nicotine to marijuana.
So I can answer that as well. So in our study and other studies, there was a large percentage of people who were vaping a combination of marijuana and nicotine or just marijuana that had problems, in addition to people who were only vaping nicotine. So we've seen it essentially across the board for these lung injuries. So it's not as if one is safer than the other. I think we're more likely to see these problems with people who smoke a combination or just marijuana, because so much of the marijuana comes from the so-called black/gray market in areas where it's not legalized, and you get the cutting with the vitamin E acetate for this particular outbreak. So I think that is why you see it more there than in other areas, but you can certainly have problems from both and or the combination.
Right. So the take-home message is your lung is only designed to breathe in
Air.
air. Correct.
Exactly.
Yes, not any other chemicals. And at the beginning, your lung will try to adjust to repair the damages. At the end, your body will give up because it's just too overwhelming. So then they start to repair by the fibrous tissues and all that. And then your lung supposed to be like a sponge, be able to absorb air, and then later on become a piece of rock. And then there's no way for air to get in, as Dr. Butt showed. And that airy, spongy lung tissue become all solid, all the pathways are blocked. So then your lung is no longer useful. But we all know oxygen, how important oxygen is to our body. So that's the take-home message. Mm-hmm.
How about Sammy? Do you have any comments?
I have a question, actually. Hold on. Are there any advantages of vaping compared to smoking traditional cigarettes? Or can you restate if you said that already?
So I think that's a little bit of a loaded question. So we know, because we have decades of experience with traditional cigarettes, how many carcinogens are there when you burn, because you're burning the cigarettes. And so the risk, there is a very well-known risk between smoking cigarettes and lung cancer. And that's because of that constant exposure to the carcinogens that you get when you burn traditional cigarettes. So one of the ideas behind vaping is that there are less chemicals there. That said, if you look at that list that Ellen showed you, as well as now what has happened with the cutting with the vitamin E acetate, there are also a fair amount of chemicals that you get when you burn, when you vape. And so my suspicion is that over a long period of time, we will come to see that there may not be an appreciable advantage of vaping versus smoking cigarettes. But full disclosure, that data is just not there yet. But it's not as if it's pure water vapor. There are plenty of chemicals there. Are those chemicals worse long-term compared to burning traditional cigarettes? I don't have a good answer for that yet. So probably not. Probably not.
Well, thank you.
But it's a great question.
Yeah. All right.
How about Brock? Do you have any questions?
Yes, I do. Is vaping illegal anywhere? Like in any part of the country or anything?
I don't know. Is it illegal, Ellen? I don't think it is. I mean, now you can't sell it.
It's illegal to sell across the country. That's what the law is. So you can't sell to a person under age 21, and a person in a store that does that can get in trouble and actually get arrested or possibly get a civil citation. But it also, in Hillsborough County, for example, if you're under age 21 and you're caught vaping or you have a vape device or vape materials, it is a civil citation. So yes, if, I don't know if you want to call it illegal, but you can definitely get a ticket and you can go to a class and there'll be some sanctions. So the idea is not to get people in trouble, but the idea is to let everyone know that it is not healthy. And so you have to have some kind of a carrot and a stick. And in this case, it's a stick. And we really don't want people vaping because young people, especially because it's bad for your lungs and for your growth.
Right.
So yes.
Thank you.
Right.
Thank you.
And also, if you want to have a really successful career in the future when you grow up, you got to stay away from all chemical and substance abuse because they will show up in the drug test and you will not be able to get a decent job. And the most importantly is your responsibility as an individual, because we shouldn't wait for people to regulate us. We should self-regulate and be educated on what is good for our health, what is good for the society, and make that decision and do the right thing. That's the bottom line.
Thank you.
And let's not forget about the secondhand. We know about secondhand smoke. That's very clear how dangerous that is. Secondhand vape, it can also be dangerous, and especially for young children. So there's parents, maybe they're vaping in their house right around their young children. We still don't know all the effects of that. So it's not just affecting you, you're affecting other people. not
Right.
and also with the example you're setting. So everyone should try to be a good role model for others.
On that topic, because I wanted to bring up secondhand smoke. What exactly are the dangers of secondhand smoking, vapor and cigarettes, as compared to just traditional smoking, a cigarette or a vape?
So we know for cigarette smoking, the secondhand smoke has high concentrations of the carcinogens in it, and so you gain quite a bit of damage from breathing secondhand smoke. To me, it's one of the worst things about smoking traditional cigarettes is that not only are you hurting yourself, you're hurting everybody around you. I get so upset when I see people smoking in public, and especially when you have kids around, and it just seems unfair. Anytime you're breathing in somebody else's secondhand smoke, your risk of developing lung cancer is going up, and you didn't do anything. That person is then basically forcing their bad decisions on everyone around them, which is incredibly selfish. And as for the secondhand vape smoke, again, we're at the beginning of the story, and so we don't have the data to support how much damage you might receive from secondhand vape smoke. But if we look at the past, with traditional cigarettes, in the beginning and for a long period of time, people tried to secondhand smoke didn't do anything. Now we know it absolutely does. I have seen people with lung cancer never smoked in their lives, but they had a spouse or a family member who smoked heavily inside their house, for example. They got cancer because of their house. And my suspicion is that other people will do the exact same thing. And there are chemicals in the vape, and so someone else is breathing it.
Right. Thank you.
Just one other thing to add to that, as far as marijuana smoke and marijuana vape, there's been studies showing that in Colorado, there were parents who smoked marijuana in the house, like especially a small room with their children, and the children were being admitted to the hospital more with lung problems. And sometimes even for small children, that amount of THC in the strong marijuana that is sold now can actually get into a child's system secondhand. So it's just dangerous all the way around, and we're just experimenting on not only ourselves but other people with using either vaping or smoking. But that was a very good question. Thanks.
Very good.
Hi, Ellen. Could I just add one quick thing? I think for an immediate thing, like we were looking for to get the word out to the youth, might be using an Instagram message, using some of the slides that Dr. Butt was kind enough to share, and just with a youthful edge to it, because these kids are all stuck at home right now. So until we can get back to the schools to do our continued education, would the youth that are on the call agree that Instagram would be a better platform, or would Facebook be a better platform to try and send out some cool, trendy, creative looking messages about vaping and the dangers associated? I'd love to hear your feedback.
I definitely say Instagram.
Okay.
A lot of the kids are using that as opposed to Facebook. Facebook is really more so the uncool older cousin of social media. A lot of the kids are using Instagram these days. That's what I would say.
What about TikTok and some other, what else is more useful for young people these days?
I mean,
Sahil, what do you think, Sahil?
Okay, so I'm thinking what you should do is just put on Snapchat and Instagram, because I know a lot of people use those apps. A lot of the youth does. And
You think Instagram?
Yeah.
Okay. So let's work on maybe
too.
for homeworks. Let's come up with some Instagram memes, or I don't know if I'm saying that right, but or Instagram live messages. And we'll meet again maybe in a couple weeks, and I want to see what you guys can come up with, some creative stuff, and we're going to have a prize for the best.
Very good. Very good.
Excellent. Thanks.
Do we have any more questions? We're having to wrap up at 7 o'clock, but just wanted to see if anyone has any final questions or comments.
I had one question, especially getting the feedback from the students, like the presentation was really informative, but from their point of view, what would be something that kind of zoomed out or was that they would change it to tell their friend like, hey, you know, this is actually interesting, instead of like a homework or like a school vibe? Like, what would be something that they think would call out their attention based on this presentation?
That's a great question. All right, let's get a couple of answers from our young people. What stood out for you that you might share with a friend?
I think the diagram of the lungs, the side-by-side comparison, that was pretty, I didn't know that, and I wouldn't know to say, hey, look at this prior. Because that is pretty, when you look at people who grew up with the dawn of cigarettes, it almost looks like history is repeating itself. So I'd say the diagram between a clean lung and one under the impression of vapor, or cigarettes for that matter. But on the subject of vape, I'd say that visual.
Okay, good. I think that's a great one. I like that one as well.
We could adapt pictures. Well, and the neat thing is they're not actually diagrams. Those are actual pictures of lungs.
Yeah.
So I can certainly give you those photos. I took them, so they're not
Okay,
cool. Or anything.
I took a picture of it too.
So they can.
How about some other comments from young people of what something that stood out that maybe you didn't know that you might want to share with someone? Or even if you already knew it, but something you think that you could share with a friend that might influence them. Don't be shy.
So to me is how addictive this can be. That's the scary part. So we may, young people or anyone may not be strong enough to resist. So the best message is don't try it. Just say no.
Don't take the first hit. I guess that's what, or whatever you all call it. I don't know. But I mean, just that one time to try, your friends in the back of the bus, like we talked about last time, here, try this. It's cool. It's pink or whatever. You know, I mean, you got to just have that. Just don't take the first time.
Right.
Okay, anybody else?
Hi.
Hi, Medina.
Hi, I had a question for Dr. Butt. I wanted to know with the images for the damaged airway, is that dead tissues or is that inflammation?
So that's a really astute question. So it's actually a combination of both. So the lung only has a couple of different ways that it can respond to injury. So if you think about it, like if you cut your finger, if you cut it with a knife or you cut it with, you know, a paper clip or whatever, you bleed in the same way, right? So the lung is the same thing. So when you damage it, it only can respond to injury in so many ways. So you get swelling, you get edema, and then the cells that line all the different structures of the lung die and fall off. And then you get inflammatory cells that come to the area. And then you also get different cells that try to heal the area called fibroblasts. You get fibrin, that's material that comes out of your blood. And essentially what happens is all of that attempt to respond to the injury and heal the lung creates material that fills up the air spaces. So it's a combination of a lot of different things. And over time, that can turn into scar. Just like you get scar on your skin, you can get scarring in your lungs. And as Dr. Bui mentioned, obviously a lung that is full of scar tissue is kind of like a rock. It's not going to breathe very well because your lungs need to be very elastic in order to draw the air in and out. And you think of those thin, delicate membranes of the alveolar space for air, for oxygen exchange to take place across just like 2 cell thickness. So.
Yes. So I'm an intern, and so I teach the White Tech course for the citation. So I think that the images are really impactful as well. If you could have access to it, I would appreciate that.
Oh yeah, of course. I'm happy to share them.
Thank you so much.
If you would like to share the PowerPoint with me, and then I can share it with the interns.
And please give Dr. Butt credit.
Of course, yes, we will. In fact, maybe you can put something, Mayo Clinic or your name on each slide, and then that way, if we share it, we'll have that right on there. That always, I love that, because then if you have the ability to share a slide and you already have the credits right there, it's awesome.
Yeah. And another thing, and what we can do is create some infogram, like a one-page poster, to have the message and then have some image that are eye-catching. So that will be posted on your website, or make it a little postcard. People can kind of give it to kids, or we can make some images, make questions, and make a little competition. And what is this tissue? This is lung tissue. Is this normal lung? And is that a vaping damaged lung? So just get them interest and then give them some kind of rewards.
Yeah, and we're working on a class right now for young people that either get a citation or they're just interested in learning more. So that's one reason we really like doing these chat sessions, because this gives us, the more feedback we get, the better. And Medina's helping design one of the classes, so this is great. And we can do, if you've heard of Kahoot, where you can have several, like a quiz, and then you can use your phone and answer true, false, or whatever. And I think the lung tissue is definitely going to be on there. That's going to be on the quiz.
Very good. Very good.
All right, any other like last minute question for this time? We're going to do this again, but we don't want to go too far over time because we got 2 doctors on the line here. And everybody, you know, to be cognizant of everyone's time.
I have one more question. Is the damage reversible?
Is the damage reversible?
That's a good question. So it depends on the degree of the damage. So much of the early damage can be reversed. But the people that we're seeing in the hospitals, the people that are getting their biopsies, oftentimes that damage is not reversible or can progress to scarring. So I think for most people it is reversible, but for a percentage it is not. It's just a case-by-case basis, depending on how bad the damage is. And also for those people that continue to vape. So diagnosis is very important. You know, sometimes these people come in and they're not appropriately diagnosed and they don't think it's vaping that's causing the respiratory symptoms. So we saw that in a lot of our cases in the beginning. People would have histories of coming into the hospital multiple times before they actually got their diagnosis, and they didn't know why they were sick. They just kept giving them antibiotics, which of course are not going to fix damage caused by vaping. So.
Yes.
All right, well, I think we all got a lot of great information. We had a good interaction with 2 physicians, and we thank you so much for participating with us tonight, Dr. Butt, Dr. Bui, and all of you that took some time out of your schedule to you know, participate with us. And please, all the young people, we want you to be working on your PSA or your Instagram video or whatever you can come up with in the next couple of weeks, and we will have a contest to see, get some information out there aimed at young people to keep them from vaping. So
group photo.
And can everyone put their
Can
screen
everybody
on?
show their face?
Yeah, everybody show your face for a minute. We just want to get one picture of everybody that, you know, you're really there, okay? Everybody just flip your screen up for just a minute.
Come on.
So we still have some blank ones.
We'll have to go to the second screen here, huh?
There we go, almost.
How many people? We have a pretty good crowd, 30 people. That's cool.
It has 34 before, and then some people
had to drop off probably. All right, well, thank you all so much. Dr. Bui or Dr. Butt, do you have anything else you want to say right at the end here?
Yeah, I just think it's really great that you're all doing this, and also very excited to see these young people are interested in science and interested in educate other people, and also the parents and everybody on the call today. And it's really a humbling experience for me, and thank you for the opportunity to be part of this. Dr. Butt, final words?
Thank you everyone for listening to me chat about pulmonary pathology and lungs. It's obviously my favorite topic. I hope I was able to tell you guys something that was of value or that was interesting. I think the key to this, to take away from this, is that vaping can be very dangerous for a percentage of people, and it's not worth the risk ultimately. And if we can spread that message to as many people as possible, then that would be a good thing. So thanks.
Thank you.
Thank you so much. It's good seeing everybody.
Oh, thank you guys.
Bye-bye.
Thank you.
Bye.
Goodbye.
Bye.
Thank you.
Thank you.
Bye.
Mwah. Hi, Sandy.